Morning, guys. I'm Dr. Harpreet Singh. So some of you guys have rounded with me, and you know my style. So whenever somebody is analyzing you for the interviews, they are basically doing the SWOT analysis. What does SWOT analysis mean? They are trying to gauge your strength, weaknesses, opportunities, and threats. So, like in one word, basically they are trying to assess, are you going to be useful to them or not? If you're not useful to them, they're not going to hire you. So how can you tell them that you are the best, you are the unique person, and you are going to be the most valuable asset for them in the residency program? So in business, we do the SWOT analysis, but I'm using this for the interview preparation. So what happens is in interview preparation is you're able to see my slides, right?
Right.
So,
Yes.
so in business, what happens is, um, so when you ask let's say you are doing an interview, the first question you're going to ask is you're going to ask, um, what is your like? Tell me about yourself. So in that, tell me about yourself, there is so much hidden. So if I ask, let's say, let's pick on somebody. If I ask Brahmjot, tell me about yourself. How would you tell yourself? You just a rough idea. Like you don't have to be specific, just a rough idea.
So I will tell that I'm an Indian medical graduate, graduate in 2021, and so since past 3 years I've been living in Canada, and I have passed the Canadian exams and the USMLE exams, and currently I'm rotating at Michigan Heart and Vascular Institute. So applied in residency this year.
So look at Brahmjot. So, your answer, tell me, if I am the medical director, if I'm the program director, how does it help me if you have passed Canadian exams, if you're rotating over here? It doesn't help me anything, right? I have 60 seconds to form an opinion about you. 60 seconds. I will lose interest, right? To create the interest, I have to have that meet. You tell me how you're going to be an asset to a program. That's what I'm looking for. So if you see that, what is your greatest strength? Everything which is hidden is what I am looking for. Is I'm looking for your experience, which you have. I want your experience. Take that experiences. I want that translated to how you are going to help me in residency. How are you going to be a team player? How are you going to be an asset to a residency program? Yes, I can train. I take the horse to the water, but horse has to drink water. How can I can train you, but are you then following here willing to train your juniors? Give me those examples in your work life, what you have done over there. If you went to cardiovascular institute, did some rotation over there, it doesn't help me. But yes, it does help me if you tell me that you helped somebody, you helped a patient, you have a story, you tell a story. So the tell me about yourself is a huge loaded question. So you are going to tell your skills, your education, your experiences, your achievements, but that translate into how you are going to be helpful. Is it making sense?
Yes.
So that is the key thing. So that is the key thing which most last year when we interviewed people, most of the kids were missing in that things. So when you, what I am looking for is, rather than a program director asking you a clinical skill question or your clinical acumen, you are basically telling them, hey, you know what? This is the issue, and this is the key aspect what I'm looking for. Your communication skills your communication skills should take them to a clinical scenario, like a journal article you have read, like a case you have seen, right? You have to translate that into something constructive. Okay, so that is the basic question. Tell me about yourself. Ideally speaking, this question should be so elaborative that you write what you have to tell, you write verbatim, like what you're going to talk about the clinical scale. It should be so fluent that you should be able to tell me about. Now, if I put Ravi Kishore online, Ravi, I'm going to put you, but I have already trained you.
Yeah.
You're not going to say the answer you are going to say because you are a specific and you have a unique thing. I don't want you to disclose that answer,
Yeah.
but I want you to disclose the answer of multiple myeloma. Let's say we saw a multiple myeloma case. Okay.
Yeah.
Tell me about yourself using that multiple myeloma case.
I'm Dr. Ravi Kishore Reddy. My mentor always used to call that I am ready for anything. So he gave me a nickname calling me ready for anything. And he used to say this because whenever I got an opportunity, I would grab the opportunity. Like an example that I would like to give you is I had a patient with a multiple myeloma. So my mentor asked me to do a case presentation for this, and I was ready for this opportunity to grab this opportunity. I have presented it in front of the residents over here, and it gave me a confidence. It helped me to understand the uh, importance of teaching to other people. It even helped me with building my confidence in teaching. And apart from that, I also had
So after Ravi, hello, hello, hello.
hello. Yeah, Dr. Singh.
Yeah, so sorry. So you were at somewhere a multiple myeloma part. We lost
Yeah.
the connection.
Oh, okay. Um,
So tell me again. Tell me again. So couple things.
mhm.
So whatever we saw. So there was a little lag and hang. So I want you to use your hands. Why are you not using your hands? So
Okay.
so like look over here. So you have been like okay there, right? So when you are presenting,
Mhm.
so when you are presenting, you're obviously not going to stand. You
Yeah.
have this torso. The person, you can only see the torso like this.
Yeah.
So I am Ravi Kishore Reddy. So obviously you're sitting. I'm Ravi Kishore Reddy.
Mhm.
And my mentor used to tell me, Mr. Reddy is always ready. Okay.
Yeah.
And why? Because he asked me to do a presentation to residents, and
Yeah.
I was ready with the presentation within 6 hours.
Yeah.
I was ready with the presentation and I was able to give the presentation, and all the residents whom I was teaching, whom I was teaching, they
Mhm.
came and told me you did an excellent job. Now look at your presentation and my using the hands.
Yeah.
Immediately it changed the perspective of a person. Now, you
Mhm.
cannot stand right over there.
Yeah.
Okay, so what you have done is You have created a communication skill. You have taken the clinical skill. You have taken the opportunity I gave you in my observership. So you have taken that thing and extended that into a clinical skill, and you have told that how involved were you,
Yeah.
right? And
Yes, sir.
immediately, bingo. So you now they are going to remember you as Dr. Reddy is always ready,
Yeah.
right? You
Yeah.
have created a nickname for yourself in the interview. Dr. Reddy is always ready.
Yeah.
So take whatever you have and make it your own, and immediately you will shine. Okay. So you have taken that, tell me about yourself, not telling me the fluff. I am from Hyderabad. Hyderabad has chutneys. I'm going to eat masala dosa over there,
Yeah.
right?
Yeah.
Not telling me the fluff. I want the real substance. Yes, you are doing rotation in Apollo. How does that help me? It doesn't help me,
Yeah.
right?
Yeah.
Plus, your interview is such because you've worked with me, it is supported by a recommendation letter.
Yeah.
So you have to just do like, you have to start thinking and you have to write everything when we do the final session, write everything. I don't
Yeah.
want to think. I only want to think the hand gestures. That,
And
okay?
yes, sure, Dr. Singh. Yeah.
Okay, so this how to now, it is very important that you have to understand the crux, that if you have read one journal article, very interesting journal article, you can spin that. You don't have to present a case report.
Mm-hmm.
So, Brenda, so you are also
Yes,
tell
sir.
me about yourself.
Hi, I'm Vrinda Pahuja. I'm an international medical graduate from India. I am right now in New Jersey working as a medical scribe. I've been in this job over a year, and it has given me an insight into the US clinical experience that I was not exposed to before. And this equipped me with the skills to pursue my residency here. It has strengthened my decision of pursuing this um, residency, and I want to use all the resources that I have available. And I'm excited to be here and to be interviewing with you guys.
So, look, again, it's a great answer, but can we improve this?
Yeah,
Now,
I got nervous. I removed half of the things that I had in mind. I'm sorry.
so no, again, it's good, but again, you have to see that you are working as a scribe, right? How can we transform this scribe experience to your benefit? How? Tell me how.
So my scribe experience has basically increased my first, of course, clinical skills, because over a year I've observed my doctor take a lot of different kinds of cases, and which just observing those has increased the kind of knowledge that I did not have before. It has increased my documentation skills, which I had no idea how EMR works back in India, and now I'm working on it every day.
Okay, so
And
look, I can tell you this. I have not seen your CV, right? You have not sent me your CV, right? You
no,
agree
not
that,
yet.
right?
Yeah.
So I can tell you the best answer for this. So when the patients come to the clinic, they have 4 or 5 problem lists, right? They have 4 or 5 issues going on. One,
Mhm.
two, three, four, five. So I'm Vrinda Pahuja, and I am working as a scribe in New York. I am from India, and I did my schooling from there. As a scribe, what I have learned in my medical school, I am putting that into my experience. What the best thing which I observed was answering the patient's expectations. When the patients come to the clinic, they have expectations. I was able to prioritize their expectations and write in the chart. And that's what this being a scribe has taught me. So you have 4 complaints. You are right as a scribe. Patient is coming for chest pain. Patient is coming for lisinopril refill, Lipitor refill. Patient is coming for vaccination. But you were able to, because the doctors in America have 20 minutes per appointment or 30 minutes per appointment. They have constraints. I was able to make my doctor's life easier. Look, the same thing you have told the program director, that you are going to make somebody's life easier, right? The same thing. It's, you have the material in your CVs, but how to present and how to extract it out, and that is my role. That is how this presentation is. How to present your strengths into taking that into point A to point Z.
Yes, sir.
Make sense?
Yeah, it does. I'm sorry, I'm not wearing shades. I'm sitting outside and my photochromatic lenses are kicking in. I'm sorry if that
No,
I'm not
okay,
trying
that's
to be
okay.
rude.
No, you're doing great. You're doing great. So in strengths, so how can you, when you have tell me about yourself, you have to drive the boat towards your research and academic interest. Now, in a community program, if you start telling them that you want to become the #1 researcher, nobody's going to care about that, right? Right? So in the program, you have to kind of gauge what the program is about. With your research articles or poster presentation, there is nothing earth-shattering you will do. The only research thing which we are looking is not your research articles. We are looking for your team spirit. Are you a team player? I had a student who had a stellar CV, stellar, but he was first author in everything. So that tells me what? He's not a team player. How can either you're making other people slave yours? How can you do 200, 300 publications, all first authors? There's only one way. The other second, third, fourth authors, they are working for you for the name, and they are doing this much part, this much part. So I can tell who is the right person or not. Okay. So have you been involved in a research project? Please describe your role. This is what I mean. How do you plan to incorporate research pursuits into the residency? Are there any particular areas of research without specialty that interest you? So not only you have to tell your skills, how can you tell your skills, your communication, your clinical skills, but we can, I had a, so if you see your careers and goals. So if I ask you the most difficult question, let me ask Kalyan, where do you see yourself in 5 years?
Doctor, thank you for giving me this opportunity to attend this interview. So, if I want to answer this question, after completing my intermedicine...
So wait a minute. 30 seconds you have spoiled.
Yeah.
30 seconds are gone.
Yeah, sorry, doctor.
Yeah, 30 seconds are gone already. So thank you so much. So, okay, just keep on. You are in the interview session. Let's say, where do you see yourself? You have already told, tell me about yourself. The next thing is, you tell me your 5 year. Where do you see yourself 5 years from now?
After completing my intermedicine residency, due to my past experiences, I want to see myself as a community physician where I can serve the people internal illness and make them happy.
Okay. So happiness will give you your job satisfaction, patient satisfaction, patient experience, your money, and everything.
Yeah, which will give me my satisfaction due to my an experience that I have faced in my childhood with my dear friend, Mr. Lima.
Okay. So this question is multifold. This tells me your vision. This tells me your vision. So this has to be where, tell me who gives you the paycheck? Patients, insurance company, your hospital, who will give you the paycheck?
If I work in hospital gives me the paycheck.
And how does hospital make money?
After through insurance companies.
How does insurance company make money?
If we treat a patient and we scribe everything and that is done into a coding, these coding bills will be sent to the insurance companies and they will release the money.
Okay. So how can you, tell me about yourself. Thinking of what I have told you right now, tell me about yourself. Explain me in detail. Tell me about this. Sorry, not tell me about yourself, showing where you will be 5 years from now. Combine both the questions. Tell me about yourself and combine where you will be from 5 years from now.
I am Dr. Kalyan Nayak Guglotu, coming from a small rural place in India where the health and education facilities are minimal. So rising in a small town like that and coming here, I want to give my best to the people who are underserved in the health, and I want to give the health education to the people to improve on self awareness of their health and want to prevent from getting chronic illness.
So you want to help people in a small village. So why are you in US then?
So US is a country of immigrants where it will give broad opportunities to uh, increase the knowledge and advanced technology which can help in quickly diagnosing the patient diseases.
So then you, from 5 years from now, after taking, that means all the knowledge you will take, you after doing residency, you're going to go back to the small village in India, right? This is what you mean to say, right?
No,
5 years
doctor.
from now.
Wherever I am, I want to serve to the underserved communities. Here or in India, I want to serve the underserved communities where the
So this is the problem, right? So you see the problem,
yes,
Karyan?
doctor.
And there's no harm. This is where the problems, we are going to solve the problems, right? So this is how you frame up. So tell me about yourself. If you keep on telling about the rural village, where you are from, there are a lot of problems. The doctor who's interviewing you is going to tell that, hey, you know what? Uh, so the doctor who is going to say and see, they are going to say that, hey, you know what? I don't want to take you. Why should I train you if you're going to go back to India? So, so you see that?
Yes, doctor.
there's a huge problem. You're telling me that there's a problem in India, and you're telling me, and I'm asking you, combine both the questions. Tell me about yourself, and where do you see yourself in 5 years? So that is the key where. So obviously, when you start rounding with me, I will explain you, or maybe before that. So we have to improve this part, that 5 years from now, remember, the main goal is patient. Patient comes first. How you don't say that I'm going to be the number one cardiologist in the world. Don't say I'm going to be, no. How are you going to impact the patient 5 years from now? That is and that should come out from your CV, from your experiences, from what you have done. Momna. Momna.
Yes, sir.
So
Yes, sir.
from your experiences when you were in Pakistan, like uh,
Mm-hmm.
you um, you served in communities, right?
Yes, yes, sir.
5 years from now, connect those things, how you helped those communities. I have an advantage on Momna's CV because I've prepared and helped. She's my student. She's working with me as a co-author in my book. So
Right.
tell me the experiences you had in a Pakistan, in that where you helped the kids and everybody. You helped, and connect those dots together from your experiences in the Pakistan, that
Mm-hmm.
you did that, and 5
Mm-hmm.
years from now you're going to help the patients like you used to do in Pakistan. Tell me, give me that answer.
All right, sir. Sir, is it okay if my camera is not on? I am actually
I
in a
know,
place, right?
I know where you are. Okay, I can
Okay.
get it. Yes.
All right. So, if I have to connect that, most of my experiences in Pakistan, where I did some projects regarding health education, were actually based on the idea that a lot of people, especially my country people, they are unfortunate in one sense, and the thing is that they are unable to understand the guidelines explained by physicians. There's always a communication barrier between the doctors and the patients, and that is something that I've seen every in every clinic in every city, whether it's a rural area or it's an urban area. So this is something that I wanted to work on since my medical school, and I did that through a lot of projects that I did on multiple topics. One of the topics that I worked on was hypothyroidism. I actually did that in a community-based setting where I went to people and I talked to, especially specifically women of reproductive age who are more exposed, or let's just say who have a higher chance of getting hypothyroidism. So one of these activities, if I have to relate the concept that I actually was trying to work on in future, is that in my future I would like to work in a competitive specialty where I can actually use my talent of patient advocacy and health education to teach patients in another setting, even if it is not a rural setting, to break the barrier between patients and physicians. I believe that this barrier exists at every level. It's not about your socioeconomic status or whether it's about your educational status. Sometimes you can be very educated, you can have a high level of qualification, but as a patient, you're unable to understand what the physician says. And this barrier needs to be broken down at multiple levels. So I would like to work on that in my future.
So 5 years from
Yeah.
now, you want to be a patient advocate.
Yes, sir.
So, and patient spokesperson,
Mhm.
and health literacy coach.
Yes, sir.
So
Understood.
and that's the last line you will. So basically, you have connected your past, and nobody can take your answer, because you have to have that material behind you to
Yes, sir.
to
To
give.
support that.
Yeah. So you have to have a foundation which they cannot create overnight.
Understood, sir. Right.
So this is so let's go to the next slide. So this is an interesting slide. Weakness and adversity. SWOT analysis. So tell me your weaknesses. What is the hardest part of journey? What is going bad for you? Challenging case you encountered. So this tells me, number one, the growth mindset of the kid. Do you have a growth mindset? So this weakness and adversity will tell me the how you overcame that and how are you able to handle high stress situations. So remember, every hospital has a criteria, objective criteria. You have score of this, you will get interview. ERAS this is. But once you reach to the interview, once you get one interview, you need only one to match. And you have one, that one day has to be your day. Once you reach the interview, that is it. How are you going to devise that thing? So this is what you have to say. What are your weaknesses and adversities? So, Ravi, tell me about your weakness or what hardships you have faced.
During my first week of the observership, I had a communication gap, and I tried to improve my communication by regularly coaching, regularly having conversations with other people, and regularly speaking to the patients about their hardships and all. This I tried to improve my English in this manner. And yeah, even my mentor helped me a lot by regularly speaking in English, having communication. He gave me multiple projects where I was put in a spot to make sure my communication, the range of explaining that I have to do will improve my communication skill. And yeah, this is how this was one of my weakness that I was trying to overcome during this time. Yeah.
So, very, very good answer. You have come so far, Ravi. Oh my gosh.
Thank you,
In
Dr.
1 month,
Singh.
you have come so far. So obviously, Ravi is my student, and we have worked on him a lot. And the most important thing in Ravi, one thing you have to mention over there, you have told me that you have a communication skills gap. You have told
Yeah.
me your adversity, you have told me weakness. But how did you overcome? You overcame with the help of YouTube videos,
Yeah.
self-learning modules. When you tell that you overcame with the help of YouTube videos, podcasts, and
Mhm.
self-learning modules, that tells me your growth mindset, that you are a go-getter. You are already Mr. Reddy or Dr. Reddy.
Yeah.
Dr. Reddy is already always ready.
Yeah.
But this tells me your growth mindset.
Mhm.
This tells me you are man.
Yeah. Understood,
So
Dr. Singh.
everything is right. Now you always start with the why, how, what. You have to place those words together,
Okay.
connect those things, right? Make sense?
Yeah.
And you have to get rid of that ums and is.
Mhm. Yeah.
Right?
I'll
Write,
try my yeah,
write the answer, write the answer, write the answer, and then speak in front of the mirror.
Mhm.
Okay?
Yeah.
So the opportunities of radical accountability. So if, like, remember, Ravi, I told you to make a presentation, and you were up till 12:20 at night
Yeah.
doing presentation.
Yeah.
I gave you the opportunity, and you took the accountability to do the presentation and present it to me next day.
Yes.
So you converted that opportunity into an thing where okay, you give me something, I am Dr. Ready. Ready means ready. I'm
Mhm.
always ready.
Yeah.
You just get rid of Ravi Kishore Gopavaram. You say, I am Dr. Reddy.
Yeah. I'll do that, Dr. Singh.
I am Dr. Reddy, Reddy, ready, but I am always ready to work. And it becomes a little rhyming thing.
Yeah.
And nobody can steal it from you because you are Dr. Reddy. Ready means ready.
Yeah.
And it will give like a humor, a chuckle,
Yeah. Understood.
So, and your last name in passport and ECFG certificate is Reddy, right?
It's my surname is Gopavaram, but yeah, I can even use it as Reddy. So doesn't, I
No, no,
mean,
no. What is in the passport? What is in the ECFMG?
Gopavaram, Gopavaram.
Oh, okay. For timing you can use, but can you get it changed? Can you make it Dr. Reddy? Can you get
I
it changed?
I can put like a preferred name, so I can put like Reddy. So over there it will be showing the preferred name as Reddy.
Okay, okay, okay. That's fine. Then that's what I want you to go because that's your caste, right?
Yeah.
The preferred name. That is your real caste. You're not making it up, right? That's the
Yes.
true thing, right? That's your village thing and all. Gopavaram
Yeah.
is your village, right?
Yeah. Yeah.
So, but you are Reddies.
Yeah.
So this is good. So again, so opportunities change into radical accountability. Then last is threats and dilemma. What? So if you see over here, threats, what was your quick? So if you were faced with dilemma, what was your action plan? Describe a situation where you faced an ethical dilemma in your medical training. How did you resolve it? Tell me about the time when you worked with a difficult team member. Basically, a threat. Now, if you see, ideally speaking, if you see all the people in the pool, they're fighting, right, for one seat. But should you really pay attention to that? No. Why? Because you may have 270 score. You may have 280 score, but if you are not able to communicate well, you may have 250 score. It's all communication game. And change the communication to clinical scenario. All right. Any questions you guys have before we wrap up?
Sir, I have a question.
Yeah, please go ahead.
It's a little different. The question is actually, especially if you are a recent graduate and like you don't have a lot of clinical experiences, and usually there is a question in your interviews where they ask, tell us about some kind of conflict you had in a clinical setting or some kind of interesting case you saw. If we don't have a lot of experiences in that sense, how do we cope with that?
That's a very good question. Very good question. Now, the question I have for you is, this clinical scenario is the hospital setting or the clinical setting
Um,
or any
Generally,
setting?
like the question I write a PDF of like interview questions, and they were using the word a clinical setting. So I'm not sure if in interviews they say hospital or something else, but that's the way it was written.
So can you repeat the question once more?
Yeah. So there are like two different questions usually people ask in interviews. And the first one is that tell us about some interesting case you saw in a clinical setting. And the second one is tell us about some difficult situation that you had to cope with or handle in a clinical setting in terms of a clinical case, not something that you did like, in bookish manner, but in terms of handling people in a conflict or something like that.
So when you were rounding with me, was there a case you saw which was difficult with me? How did
Well,
I?
there was one case, especially in the last week, I remember there was an alcoholic patient who was having recurrent strokes, and he was refusing to give up on alcohol, and the family was not the sons of that person were not, coming to see him, and that was difficult because he could not make a decision by himself. So that was a difficult case in that sense. How do I explain it in a more interesting way?
Yeah.
That how does it affect me?
Okay. So so always whenever you have a scenario like this, what I do is I use the
Mhm.
approach why, how, and what. Okay. So
Okay.
this is the approach I use. Why, how, what. So I saw a very interesting scenario with my mentor in my last rotation. I saw a patient um, who used to consume a lot of alcohol, and while in the hospital, nobody came to see him. I went to the why of the problem, why nobody was coming to see him. Was it financial issues? Was it emotional issues? What exactly happened to him? Why there was so much of disregard for their family member or something like that?
Okay.
So when going to the why of the problem, the family members told me that the reason why they're not coming to see him is number one, he has financially drained all the resources from a family. Okay.
Mm,
And
okay.
after draining all the resources, they're not left with anything. They don't even have a car. They don't even have something, they cannot even transport. Then, they don't have a way to come to the hospital. Very simple thing. Let's say if it's not the way, or they don't want to deal with him anymore because when he comes to their house, he disrupts the entire family and they have
Mm-hmm.
young kids. So again, whatever scenario you have had, now you're preparing the interviews, whatever you have, again, we can devise your questionnaire into such a way. Obviously, I have to think a little bit more, you know,
Mm,
and okay, so I have to think a little bit more. How can I answer this question that um, which will appease the person?
okay. Okay.
So again, you have to tell me more stories. You've given me just one story, okay? And
Yes.
we can make more stories about it. So side effects of alcohol, right?
Mm-hmm.
Now it came to my mind that, and when I was explaining to that person about the entire family about the side effects of alcohol, this
Mm-hmm.
came to out of mind. And then suddenly the verbal cues came into the picture and they were more concerned about that. And then remember, we can do the Victoria's Secret story, we can do this. Now we can do a lot, right?
Yes, sir. Understood. Understood. Right. Sir, I have one more question, if that's okay.
Yeah.
Yeah. So recently, last year, two of my seniors got this question from an American program director
Mhm.
that, like, you have done so much volunteer work and clinical work in your own country in Pakistan. Now, why not further train in Pakistan? Why do you want to come to US? Although you have such vast experience in Pakistan, you have experience in good places, yet you still want to come into US. So in this situation, how do we say good things about like US without saying bad things about our own country? Because when we say that we want to be, in a better training program or something like that, they're going to ask, how do you consider us better than, that program? And how do we tackle that question?
That's such an easy question. That's
Really?
more, yeah.
Mhm.
I want to see the best of both worlds. I have trained
Oh, wow.
in an underprivileged places, And
Mm.
those underprivileged places have taught me ethics, skills, talents, but I want to polish it further and want to be in the best of both the worlds.
Mm-hmm.
Simple, straightforward question,
Uh-huh.
and from underutilized resources to overutilized resources. But I want to be in the best of both the worlds. Look, my actions
Understood.
from underprivileged
Mm-hmm.
to overprivileged, and
Mm-hmm.
I want to be the best of both the worlds. Hands.
Got it. Use of hands. Yes, sir. Okay. Thank you, sir. Thank you so much for responding.
Yeah. All right. I see Simranjeet here. Hello, Simranjeet.
Hello, good morning, sir. Sat Shri Akal.
So, Srikal, where are you from?
So I'm actually from Government Medical College, Jammu and Kashmir, India.
Okay. That,
Yes, sir.
you came at the tail end of the presentation.
Right, sir. I missed it. Actually, I found it via the LinkedIn, so I just jumped right in. So
Okay,
I'm
that's okay.
sorry for that.
No,
Yeah.
that's okay. And how much did you score?
Sir, I scored like a 238 in
230.
step 2.
And step 3?
Step 3, I'm just preparing for it. I have not taken it yet.
When are you taking?
Sir, in November.
And what is your NDMB score? NBME score?
MBME scores were in 250s, sir, your recent ones.
So
For step 2, right?
yeah. No, in step 3.
No, step 3, I've not taken it yet. Again, so I'm just doing the U-Board and CCS cases.
Okay. Make sure you prepare really well.
Right.
So if you score above 238 step 2, so yours, that will be a good thing, for you.
Right, sir.
So
About
are you recent graduate or old graduate?
Right, sir. I just graduated in August 2024.
Okay. So you took 2 break between 2 years or
Right. No, I didn't. I actually took a break in my internship, which we are allowed to take
yeah.
according to National Medical Council of India. Then I went for my electives, hands-on electives in US. Yeah, that's it.
Okay. So we are preparing interview. Tell me about yourself.
So yeah, thank you so much for inviting me at an interview at your program. My name is Simranjeet Singh. I'm an international medical graduate from northern part of India. I live with my family, with my parents and my younger brother, who is also pursuing medicine.
No, 100% no. You have
Right.
60 seconds to
60
impress the
seconds.
program director. 60 seconds. How are you going to change the narrative of the program director? How do I care about your younger brother? How do I care if you're dependent on your parents? You're telling me that you are a dependent person already,
Right.
not an independent person.
What I meant to say was, okay, it came across.
No.
So should I just sort of move on with like I graduated recently at this, and I'm working at this position at this hospital. That'd be much better.
Yeah, I just explained everything. I'm going to put this video
Okay.
on.
Yeah, sure.
Yeah, just
On
see
YouTube.
that video, and this will be on YouTube, so you can see
Right.
that video. Okay.
Sure.
And this will give you an idea.
Right.
Okay. Vrinda, you have a question?
Yes, sir. So my question is regarding the strength weakness question. And so this comes from a conference that I attended, and one of the answers that they suggested was that my weakness is I'm not very good at procedures yet. But someone told me this is not a very good answer when they're asking weaknesses because it's more behavioral weaknesses. I just wanted to, take your
So the
advice on
best,
that.
you have answered the best. You have asked the best question of the day. Best question of the day goes to you. You know why? Everybody on the face of the earth has weakness. What if I ask Ravi, because Ravi has just finished rotation with me yesterday, and I can pick up so many weaknesses. The best weakness is getting a history from the patient. I am still learning at 50 years of age. I am always learning. I am still learning. If I have a weakness, if I ask you what are the 4 main questions of diplopia, what questions are you going to ask for four questions about diplopia? I can guarantee you many primary care providers will not even know this. I am still learning. I am also learning right now. That is my weakness, but I'm learning. So you have to frame the question in such a way, you have to tell that, hey, you know what? As a physician, we are always learning. And we want to be the best in our field, and our weaknesses lie in how to extract the history from the patient. I'm always learning. So if we can, if like Ravi said, my weakness was communication skills. I improved by the doing YouTube videos. You have to give a solution to it. My weakness is, I did an amazing case presentation of diplopia, and I did not know what are the 4 major questions to ask about diplopia. That was my weakness. How I overcame? I overcame by looking at the literature. That told me that history extraction is the key thing. That was my weakness. How I overcame? I went to the literature. I pulled out the 4 questions of diplopia, and that's how I'm going to ask. So you have given a solution. So anything which tells me about your growth mindset, anything which tells me that you are able to learn procedures. I don't do procedures. I don't do procedures. I don't need, I put a consultant. So you have to be, okay, so I don't do procedures. Does this tell me about your growth mindset? Yes. I don't do procedures. I was in Apollo. I was in ICU. I learned procedures over there. That tells me your growth mindset. I work as a scribe. What I learned was there, patients are coming with 10 problems. How to prioritize your problems. That's what my attending physician told me. 1, 2, 3, 4, 5, 6. Not just randomly scribe things. I was able to meet the patient. So everybody has a weakness on the face. If you don't have weakness, you are God. Changing that weakness into the strength, or how you tackle that is the key thing. Okay.
Thank you so much, sir.
All right. Brahmjot, you have a question? You were about.
Yeah. Yes, I have one question. So in Canada, I have worked in pharmacy as a part-time job just to pay bills and rents. So whenever they ask some weakness, strength, or experience, so can I just give an example of working in a pharmacy as well?
This is excellent. This is excellent. Okay. Nothing against Simranjeet. I would never mention that I am living with my parents.
Right. Or yeah.
Never.
It just yeah. I think it came out the wrong way, but yeah.
Brahmjot, you are 100% right. You are an independent woman. That gives me that hey, you know what? You are working on your own to pay your bills. I love it. Now how to change that narrative? That is all things which we do, right? How to change that into a positive thing, that 100% I would mention that. 100%, because that tells me your eagerness to support your family. That tells me you are a workaholic. That tells me that you are love it.
And what if they ask me that why you chose US over Canada?
So I want to learn every system.
Okay.
I want to learn best of both worlds. I want to experience. Remember, we travel. Why do you travel all over the world? Experiences. I want to experience. I have experienced India. You were in Indian medical school, right?
Yes, Amritsar. I graduated from Amritsar.
Amritsar. You were in Indian medical school, and then you came to Canada. You got the experience from Canada.
Right.
Now you want to, it's all words. It's good communication, and tackle that into those things.
Okay.
All right. I think the time is up. 10 o'clock.
Thank you very much.
Thank you very much, Doctor.
Thank you, Dr. Singh.
Thank you so much, Dr. Harpreet.
Yeah. So
Thank
no,
you, sir.
I'm
Thank you.
I'm not Dr. Harpreet. I'm Dr. Singh.
Dr.
Dr.
Singh.
Singh, sorry.
Here
I'm really sorry.
you have to be very particular. First name, last name. And
Sure.
and Kalyan has a habit of saying, yes, doctor. I keep on telling him, Dr. Singh.
Yeah, as Dr. Singh,
Thank you, Dr. Singh.
I will change.
I'm going to make you happen, man, Kalyan.
Yeah.
I'm going to shape you up.
Thank you so much, Doctor.
Again, doctor.
Dr. Singh.
All right. You have a good one, guys. Bye.
Thank you.
Good day, Dr. Singh.
Bye. Good day.
Bye.